Welcome. Thank you for joining us today for this Suicide Talk. My name is Sarah Dobra. I am the Behavioral Health Director at Chatham County Safety Net Planning Council. I'm also an ASSIST trainer. ASSIST is an acronym for Applied Suicide Intervention Skills Training. I'm here today with Dr. Bilton, the Director of Employment with Savannah-Chatham County Public School System. She is a certified ASSIST helper and is a SuicideTALK trainer. We are here today with our Chatham County Prevent Suicide Today program. We have been working in Chatham County, Georgia since 2017 in partnership with Gateway Community Service Board and other diverse community partners. Together, we are implementing an international evidence-based training. One training is SuicideTALK. That's the topic of our discussion today. The other is ASSIST, which is a 2-day skills-based workshop. We'll spend a little bit more time talking about ASSIST at the end of today's session. We're so glad and thankful that you've joined us for today's presentation. Today, we're going to be thinking about our entire community because we think that by working together, we can prevent suicide. It is our goal for everyone to know that help is available and where to find it. So today, during Suicide Talk, we are going to understand the impact of suicide in our community. We are also going to explore how personal and community beliefs about suicide affect suicide stigma and safety. We are going to learn how to take the first steps towards suicide prevention and how to contribute to suicide safety in the community. I do want to highlight for you the Georgia Crisis and Access Line number. It is 1-800-715-4225. We are talking about a difficult topic today, suicide. And if you need immediate help, please call that number. There is support there for you. We're going to watch a brief video of Georgia youth who have tried to die by suicide. This video is powerful because it's hearing in youth's own voices their experience. I actually sat in the audience where many of these youth were the experts on a panel to state legislators and policymakers talking about suicide, their experience with it, and their school's response to their suicide attempts in their schools. I think it's powerful to remember that youth have their voice in this and that we can learn from them as we are thinking about the suicide safer community.
I've struggled with depression since I can remember. I just felt like I was just falling and falling.
At that point, the whole world basically caved in.
Kind of feels like it don't matter.
I was really lonely. It just kind of felt like nobody cared. I thought it would be better just to end it.
I tried to kill myself. I actually tried 4 times. I tried to overdose on pills.
I have attempted suicide once.
I tried to overdose. Last year, I had a suicide attempt.
You see cancer ads on TV. Where's the advertisements for trying to get people with anxiety disorders help?
Just because you're crying doesn't make you a weak person.
I don't know a kid that hasn't dealt with anxiety and or leading into depression. You're not the only one who has this problem. Other kids have the problem. And by working together, you can get through it. We need to get rid of the stigma around not being mentally healthy.
So let's begin with looking at numbers, statistics, which speak quite loudly and help us better understand the impact of suicide on communities at large, as well as individuals. First, we'll look at the bigger picture, national data on suicide, and then gradually we'll narrow it down to state and Chatham County level. According to the latest report by the Centers for Disease Control and Prevention, the CDC, that was just released in June this year, suicide rates have been rising in nearly every state, and in half of the states, suicide rates went up more than 30% since 1999. In 2016, nearly 45,000 Americans aged 10 or older died by suicide. The conservative estimate is that for every death by suicide, 25 or more people attempt. Also, while we are talking about the national statistics, we thought it would be important to include the following slide describing suicide rates among the youth. This survey was completed with U.S. high school students 9th through 12th grade in public and private high schools throughout the United States in 2017. Few that we like to highlight from the most recent CDC report is that in 2017, over 17% of students had seriously considered attempting suicide. Almost 14% of students had made a plan about how they would attempt suicide, while 7.4% of students had actually attempted suicide one or more times. Female students were twice as likely as male students to have seriously considered attempting suicide. Also, about 1/3 of students had felt so sad or hopeless almost every day for 2 or more weeks in a row that they stopped doing some usual activities. Lesbian, gay, and bisexual youth seriously contemplate suicide at almost 3 times the rate of heterosexual youth. Now let's take a look at Georgia's statistics. The suicide rate in Georgia has increased 16.2% since 1999. Also in Georgia, twice as many people die by suicide as by homicide, and nearly as many people die by suicide as by motor vehicle accidents. On average, 1 person dies by suicide every 6 hours in Georgia. Now let's take a closer look at Chatham County. In the community we have launched the Prevent Suicide Today program. It is estimated conservatively that in 2016, almost 1,200 people attempted suicide in Chatham County. Reportedly, 47 people died by suicide. This compares to 54 deaths through motor vehicle accidents and 52 deaths by homicide in Chatham County. Each of those 47 individuals had family, friends, co-workers, and others who were impacted by their death. In our Prevent Suicide Today work in the community, we see that for many people, the answer to questions is also a yes. It might be for you as well. So yes, every single suicidal act has a lasting impact on those left behind. It is very likely that over our lifetime, all of us will be touched by suicide in one way or another. Just recently, many people felt the impact of suicide when the news reported the deaths by suicide of Kate Spade and Anthony Bourdain. What does that say about suicide? One of the things it says is that suicide can affect people from all walks of life, and it could happen to any of us.
So, as we think a little bit more about suicide, we want to look at 5 common misconceptions and thoughts about suicide. So the first one is that people who talk about suicide won't really do this. The fact is that as many as 75% of people who do attempt suicide do or say something to indicate their state of mind and intentions before the act. To me, this is a hopeful statistic. It tells me that for most people, the majority of people who are thinking about suicide, they do ask for help. They are giving signs that if we are aware of, we can reach out to help them. Now let's look at anyone who tries to kill him or herself has a mental health condition. In fact, 54% of people who died by suicide did not have a known health condition. What we really want to think about here is that suicide can impact anyone. For some of those people who died by suicide, they may have had a mental health condition that wasn't diagnosed. But for others who die by suicide, they may be making a rational choice in response to their situation. And understanding that suicide is not always a result of a mental health issue is helpful for us as we reach out to those around us. Talking about suicide may give someone the idea. This is a common misperception. In fact, asking someone about suicide will not put the idea in their head. Many people having suicidal thoughts often feel relieved when someone asks. In fact, asking that question will tell the person that you are a safe person to talk to. People who die by suicide were unwilling to seek help. Studies show that more than half of suicide victims sought professional help within 6 months of their death. And we already heard that over 75% of people who die by suicide also seek help. That tells me individuals are looking for help, and we can be there to give it to them. If a person is going to attempt suicide, nothing will stop them. The fact is, most who attempt suicide remain uncertain of the decision until the final moment. Most suicidal people don't wish for death, they simply wish for the pain to stop. Understanding this is helpful because as we're thinking about suicide prevention, we can also help someone to think about keeping safe for now. So as we're thinking about these myths and perceptions, we want to understand how to talk clearly about suicide. This is an uncomfortable conversation, but it's going to be helpful. There's one initial note I just wanted us to make is that we will say someone dies by suicide rather than committed suicide. This recognizes that it's not, we would say someone commits a crime. And we don't want to put suicide in that category. We will say someone died by suicide. And so just a note on our language there. So if talking about suicide openly can help to prevent it, that's something we want to do. However, it's uncomfortable. So we want to encourage in this dialogue being uncomfortable, but taking the steps to do that, to talk openly about suicide. There may be different reasons why we don't talk about suicide. It could be shame and stigma. It could just be that's a really difficult topic to talk about. It could be because we have personal experience with it, or it could just be unconscious. Many people avoid talking about suicide without even realizing that they are. So we've already touched on this a little bit, but talking about suicide is tremendously important because when we talk about it, we are working towards preventing it. When we have open dialogue, when we share our stories, and when we identify resources, then we can help to reduce stigma and make it easier for people at risk of suicide to come forward to get the help they need. We can give them tools and language to ask for help. So that's what we're doing here. We're becoming uncomfortable talking about suicide in a more comfortable way. We also, as we do this, want to think about our attitude and how it shows to others. We want to portray an attitude that says, I'm a safe person to talk to. As we've been in the community this year doing Prevent Suicide Today and talking openly about suicide, we have people who come to us every single day to share their suicide stories and how suicide has impacted us. That's because we're starting these conversations, and we encourage you to do the same. So to do that, we want to understand a little bit more about thoughts that someone who is thinking about suicide may have, the needs they have, and we as helpers, some of the questions we might have. So a person who is thinking about suicide may wonder, should I tell about suicide? Do I have the right to involve someone in my problems? Do I have the right to ask for help? A person who's concerned about somebody and may want to be there to help has other questions. They may be thinking, should I ask about suicide? Do I have the right to put my nose into someone else's business? So the answer to these questions is yes. And what this is really is, it's about needs and invitations to meet those needs. We want to understand that the person at risk of suicide is in pain. They want others to notice it. And they're sending out invitations to talk openly about that pain. As a person who wants to help, you receive these invitations, and you have to decide whether or not you are going to accept and act upon them. So some of these invitations that we're talking about are also known as warning signs. Most people who take their lives exhibit one or more warning signs, either through what they do or what they say. It's important to look for a change in behavior or the presence of entirely new behaviors, especially when related to a painful event, loss, or change. And this is about knowing those around you, being aware of who they are and changes in their behavior. Some common warning signs include a sense of hopelessness, isolation, aggression and irritability, possession of lethal means, feeling like a burden, drastic mood changes, frequently talking about death, self-harm, engaging in risky behaviors, making funeral arrangements, giving away things, substance abuse, direct threats of suicide, and low self-esteem. We're now going to shift our perspective from a helper to really thinking about the perspective of a person at risk of suicide. We're going to discuss the needs of someone who is thinking about suicide. To do that, we're going to use an acronym, TALK. The T in TALK stands for tell. I need to tell. A person thinking about suicide needs to tell someone about my thoughts of suicide. They also are thinking, I would like to tell several people. I'm aware that I may be cautious in saying it as openly as I want to, and I will be watching for reactions to what I tell you. The reason why a person thinking about suicide wants to tell is that they're still unsure about death. We know they're unsure about death because they're still alive. They have some reason that they want to potentially stay alive, even though they're unsure. They may need help making that decision, and telling somebody helps with that. Let's make this personal as well. If we are ever thinking about suicide, if you are ever thinking about suicide, don't face suicide alone. Tell someone. Tell several others so that they can be there for you and help you to think through reasons for life. So by demonstrating that we're comfortable and willing to speak about suicide, we're going to make it easier for the person at risk to meet their need to tell. They know you will be a safe person to tell about suicide. Let's turn to the second need that a person at risk of suicide has. So they need to ask someone to ask. A person thinking about suicide says, I need someone to ask me directly. Are you thinking about suicide? Are you thinking about killing yourself? Once I have given you any reason to think I might be thinking about suicide, please ask me exactly about suicide. Ask me as directly, clearly, and as soon as you can. Right now, that is exactly what I want you to do. So the reason why we ask directly about suicide rather than indirectly is so we both know what we're talking about. The person at risk of suicide now has said that out loud, and you as a helper understands that that is the conversation you're having. And if that person is not thinking about suicide, well, you've just told them that if they ever are in the future, you're a safe person to talk to. The next need that a person at risk of suicide has is to have a listen. They say, I need someone to listen. I hope that you are a good listener. I hope that you will listen to what I need to say, not what you would like me to say. I think that one is important to note. It's not what we want to hear them say, but what they need to say to us. I have not really talked to anyone about suicide, and I need to clear my thoughts by talking through them. Perhaps any of you can relate. How many times have you had, I know I have had, a problem that in my head seems so big. As soon as I say that problem out loud to a friend, it suddenly seems much more manageable. And thinking about suicide when that's in your head is the same thing. When you can say that out loud and have someone come alongside you, it suddenly can become more manageable. And when they can talk to someone about their feelings, they may be able to come to that realization that they do want to live. Finally, a person at risk of suicide needs help keeping safe. So they're going to say, I need help, or be thinking, I need help keeping safe. I don't know what to do. Can you help me think about what needs to be done? And can you help me avoid dangers I may not fully recognize? So a person at risk of suicide often feels overwhelmed. They may feel that they have a lot to deal with and don't know where to even start. The person at risk needs someone who understands that the first priority is safety from suicide and that everything else is secondary. Whenever possible, it's important to think about removing the suicide means, if that's possible. It also means that thoughts of suicide should not be kept secret, but that should be shared with others to help keep safe. So let's review the needs of the person at risk and how we can help meet those needs. And I'll say those needs to that person, and Dr. Bilton will say that response. So I need to tell someone about my thoughts of suicide.
I am alert to you needing to tell me.
I need someone to ask me about my thoughts of suicide.
I am willing and able to ask you directly.
I need someone to listen to my thoughts and feelings about suicide.
I am willing and able to listen to your thoughts and feelings about suicide.
I need help keeping safe from suicide.
I am willing and able to help you keep safe.
So we also just want to remember that this isn't a complete intervention. It's skills, but it's an example that we can meet someone's needs and help keep them safe. So to summarize some of that in a few concrete steps, I do just want to look at and show sort of 5 steps towards suicide prevention. If you take nothing else away, take this away. Ask directly, are you thinking about suicide? Focus on safety and find out a few things to establish immediate safety. Then be there, show your support and that you are willing to come alongside that person in their pain. Help them connect with ongoing supports. There are services available in our community to help with that we're going to talk about next. And those can be immediate tools. And then follow up, show that you care, check in to see how that person is doing, and where possible, be an ongoing resource. So there are several immediate resources in our community if someone is thinking about suicide. And I encourage you to actually program these numbers into your phone. You can text them to a friend in need. I heard yesterday from a college student who said to her mother, if you're asleep, if I call you and you're asleep, the next number I'm calling is the Georgia Crisis and Access Line. That student knew she was in danger and had a plan of what she would do. The Georgia Crisis and Access Line, that number is 1-800-715-4225, and it's available 24/7. They will come out and do a crisis assessment as well. We also really like to highlight, especially for students, the crisis text line. That number is 741741. You really can text anything to it and somebody will respond. But if you text GA for Georgia, the response person will be somebody in Georgia who can also help to connect to local resources. And I like to encourage that number because if someone is still thinking about suicide, and even if they're going to the emergency department, they can be there texting and getting help to support them along that way. And then the National Suicide Prevention Lifeline is a great resource number to have. And it's also important to note they also have an online chat feature for that. So those are some immediate resources that are available.
In Savannah-Chatham County Public Schools, safety of our students and employees is a priority. As mandated reporters, we do follow board policy and state policy that if we have a student who presents with suicidal or homicidal ideation, that should be reported immediately to an administrator. Remember, as mandated reporters, we're not investigators, we are reporters. This falls under the board policy for child abuse and neglect. So if you suspect that a child is considering suicide or a colleague is considering suicide, you need to immediately report that to the administrator of your building, and they will take it from there. As an employee, you also have access to the Employee Assistance Program, which we call EAP. It is a company-sponsored benefit designed to help employees and their families address problems that can compromise personal satisfaction and occasionally job performance. Again, I just want to point out that it's not just available to the employee, but any members of the employee family. The phone number and the address is on the slide, and it can help with a variety of different things, not just suicide. It can help with financial difficulties, divorce, pressure, stress, etc. The benefit enables you to have 6 counseling sessions for free. It's totally anonymous. The board does not know who attends the EAP sessions, but they are paid for by the board. And after the 6th session, if additional sessions are needed, most of our insurance policies do cover additional counseling sessions.
So that's a good reminder that as we are thinking about others' needs, we also need to really think about and care for ourselves. Part of a suicide safer community is thinking about our own mental health and well-being. We like to think of the things that are life-sustaining, the things that give us joy. What do I do to refresh myself when I'm hurting? And so I encourage each of you are working with children, working with families because you care. You are working with your colleagues because you care. But you need to also care for yourself. Be that from enjoying neighbors and friends to your family, to pets, whatever it is, we do really encourage you to take time to help support yourself. By doing that, you will be contributing to a suicide safer community for yourself and also be better equipped to reach out to help others when they have need. So I do want to highlight that what we are doing today, the Suicide Talk, is part of a larger Prevent Suicide Today program. If we do believe that suicide can be prevented and that as a community we can do that, then there's things you can do. If you would like to have this Suicide Talk done in person in any community forum, we are available to do that, and we'll give our email address at the end of the slide. We also offer monthly throughout Chatham County 2-day skills-based workshops. That's called Applied Suicide Intervention Skills Training. So what ASSIST is you can think of it like CPR or first aid for suicide. It teaches you skills of how to concretely intervene. I encourage you to talk to your school administrators or supervisors. If you are someone who talks to suicidal individuals, then this workshop is for you. It'll give you further skills of how to have those conversations, and more importantly, how to keep someone safe, how to keep them safe for right now. And by doing that, to empower life. This takes a community, and we have many people throughout our community who are been part of that, and you can be as well. So with that, this is a community partnership. We would like to thank our partners, especially the Savannah-Chatham County Public School System, for their partnership of this and working to equip all staff, and through that, the students in your care and our families in our community with skills to stay safe and prevent suicide. Thank you.
Thank you.